Hi, everyone. Welcome. I'm Angela Love-Zaranka, Program Director for Lactation Education Resources.
I am Sekeita Lewis-Johnson, Accredited Provider Program Director here at LER.
Thanks for joining us today. Just a little bit of background. I am a board certified lactation consultant. I came through a community support organization over quite a few years ago, let's just put it that way. I've worked in a hospital, I've worked in the community, I've had a private practice, and I've also served on a few different boards of directors. What about your experience, Sakita?
Yeah, Angela, thanks for asking. I am a family nurse practitioner. I am also an IBCLC and birth doula. I too have worked in the hospital setting as well as in the community settings and in private practice. I have served on a few boards myself. So, Angela, I feel like we have almost the same like resume, so to speak. So,
We do. And the beauty though is that we come at this topic from a couple of different perspectives. And so let's get started and let folks know what they can do to follow their passion. So first, a little bit of housekeeping here. If you'd like to ask questions on and you're using a desktop or a laptop, take a look at the blue arrow and it will show you where on the interface, the GoToWebinar interface, you will find the questions box. If you'd like to chat with us as well, you're welcome just to pop something in there and we will see it. We'll see it here. Now, if you're participating on your mobile device, you can use the question button. Notice the green arrow here. You can use the question button at the bottom of the app. And so do ask us any questions that you'd like or comment. And so one comment is, I would love to know where everyone is participating from today. So where in the world are you? Go ahead and pop it into the questions box and let's take a look. Now, we do have a couple of extra folks besides Sakita and myself who are helping us out here. We've got Wendy from our customer support team, and she's going to be monitoring the chat and the questions. And she can answer some of those questions because she has been with us for many, many years, but she may leave a couple for Sakita and I to answer live. If you're having any tech issues, Jill is also on the call, and she can help with any issues that you may be having. So let's go ahead and dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you will join more than 35,000 IBCLCs in over 131 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners, more specifically the Commission. Take a look at their website. They have different regional offices depending on where in the world you reside or work. Review the requirements and the pathways to become eligible to take the IBLCE certification exam. What do you need to know? The detailed content outline, it used to be known as the exam blueprint, is based on a survey of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages that an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That's the organization that evaluates and approves lactation consultants training courses. Now, Sakita's going to review a few questions to ask yourself today. Sakita?
Angela, so before we really take a deep dive into all of the steps that you will need to become an IBCLC, as you're listening along to Angela and myself speak about this topic, you want to ask yourself a few questions, and it might be helpful to write these down or maybe just reflect on them at the end of today's presentation. But you want to ask yourself, do I have the skills? And if I do, that's great. Okay, let's build up on those skills and go next step, next level. Or if you don't have the skills, you need to ask yourself, where will I get these skills? And these questions will make more sense once we get into the topics, when we get into this discussion. And I'm hoping it will be a discussion. I'm hoping you will have a lot of questions, not just for us, but for yourselves at the end of this presentation. All right, so Before we get into the skills, meaning the task to do certain things, we're going to talk about some of the characteristics that makes an IBCLC. So when we think about international board certified lactation consultant, we're thinking about skilled clinical management of lactation related concerns. And so in order to be skilled, hopefully, by the end of whatever your training is, you will be competent. So you think about competent. Competent means having the ability, the knowledge, the skill, and the attitude to be able to master or carry out a task successfully. So when we think about competency, a lot of folks think about, oh, I'm an expert. Expert is a little bit different. Expert means that you've been doing this for a long time. Industry says about 5 years. Some folks say 3 years to become an expert. But what I'm really talking about is safety. At the end of your training, are you competent enough to deliver care that, is prudent, quality, and informed by evidence? And so, in a nutshell, you will essentially be a novice when you first finish your training. But hopefully, if you continue to practice, that will take you to that next level expert. And so competency means just being able to have skills to do no harm. And that's why being competent is so important. Culturally appropriate and credible care. When you think about culturally appropriate, some folks use the word culturally competent. Some people use the word culturally relevant. In this sense, I like to say culturally appropriate. For the sake of linguistics or the sake of semantics, you think about competency as mastering a skill, right? And so for me, that means that I can't really master someone's um, their culture, but what I can do is make sure that I am well versed in not just myself and my beliefs of cultural humility, and which is a lifelong process, but that I'm also considering some of the things that make this individual unique, some of the care practices that they may do that I need to that I need to recognize and honor, right? So delivering culturally appropriate care in a nutshell, that could mean, for instance, someone who speaks a different language and you have to communicate to them. How do you communicate with them? If you just go on the instance of you're still going to speak English and nothing else, you're never going to discuss a topic, a health topic that's relevant to their health and their sense of well being in only your language, which they can't understand. That's not really culturally appropriate. So wanting to make sure that we are clear um, that lately you hear a lot of talk about language these days. And so we want to make sure that we are using appropriate language as we decide, as we really discuss what culturally appropriate language is. And so you'll hear cultural humility, and that is again just humbling yourself. It's a lifelong self-reflection and self-critique whereby me, Sekeita, learn about not just other folks' cultures, but again, my own culture. And I start that out every encounter reflecting and remembering. And truly that's how you become credible. Some folks think that, for instance, and this is kind of how we've been taught. If you've ever heard the saying, this group of people are more likely to, right? Without context being given to why they're more likely to, right? You have to take a deeper dive, but you want to avoid saying things like, particularly in lactation, I've heard, well, this culture, they don't like that, or this culture don't breastfeed, or this culture does this. You want to make sure that you are speaking not just from your own perception, but you want to be thinking about whether it's culture, whether it's education, whether it's lack of health literacy. It's so much that it could be, and not just the culture of they don't do, right? So credible. In order to be credible, you really have to know that when you are tasked with answering a question for someone, you are tasked with answering that question fully to the best of your ability, which means if you don't know the answer, it's so important to say, you know what? Let me get back with you. And then you go dig up the resources. You're going to learn during your lactation training that there's so much to learn. There is lots of information, and some of the information and evidence is ever changing. The way you become credible is not to rely on your own experience. And for example, when folks find out that people are going to breastfeed, they are always like, oh my goodness, it hurt me. It did this, it did that, right? Again, there's no context being given. Another thing I've heard, oh, well, she said she didn't get milk, so I'm probably not going to get milk, right? Really, that's not a really credible resource. So being credible means that you are giving out information that A, coincides with the best evidence, and B, that you really know what you're talking about. So in that vein, all the information that you're going to learn, you're going to gather, it's not going to be like readily available here. We would have to be walking computers, walking robots in order to just always have the answer, right? And we're not. So really demonstrating credibility is just about being forthcoming. I'm not quite sure about that. Let me get back to you. And then getting back to that person in a timely manner. Reason being is because with IBCLCs, it's kind of hit or miss. Some people love us, particularly those that we help. And then some people don't like us, particularly when we're advocating for best practice, right? So think about the credibility that if you lose credibility as a lactation consultant, it is actually reflective on the lactation profession. And it could relate to other IBCLCs losing credibility. And that's truly not something that we want to happen, particularly with this profession, when we know that human milk is everything. It's miracle, it's medicine, it's all of the things, right? Policy advisor, creator, and advocate. Being a policy advisor and creator, it's two-sided. It's two parts to it. There are some people who know how to create policy, meaning they've taken courses. They understand that in every policy, language is so important, and how that language is laid out is extremely important to minimizing unintended negative consequences. So there are folks who are trained in policy. And so if you are one of those folks trained in policy, then you've already got that skill, right? However, all of us, everyone in the profession, as lactation supporters, we are policy advisors. Policies impact healthcare, our sense of well-being, our outcomes. And so understand that we are all stakeholders, meaning whenever there's a policy being built around the profession, around infant feeding, around any type of care, for instance, the Pump Act that just passed not too long ago, we are stakeholders because we work with families. Some of us work ground level, some of us work in administration, some of us know the issues. We are all invited to be stakeholders, to uplift our voices when a policy doesn't sound that it's going to serve the needs of all folks, and that some people will be eliminated. We are all policy advisors. And so it's coupled with advocacy because that's a big part of what we do and who we are. And an advocate is simply someone who publicly supports and recommends a particular cause or policy. So even if you're not a policy advisor or creator, so to speak, again, you can be that person at the table when policies are created and share your perspective on the topic at hand. problem solver researcher. This is probably about 90% of what we do. Whenever we are called for lactation support, it's usually because there's a family expressing a problem or some concerns. And so truly we want to be mindful of not framing the education that we're going to learn or that we may already have. We need to be careful of not framing it as a one size fits all, because we know that there's always going to be some idiosyncrasies that are everything that's it's just not going to fit. It doesn't fit this case, right? Families come with their own sorts of challenges, barriers, concerns, fears, triumphs, whatever they may be. And so you really want to be the person to help them meet their needs based on their problems that's presented before you. Being a researcher is part of that, because when you're called to solve a problem, again, sometimes you may not have all of the information, and sometimes you may need to refer back, right? So that's the part of research. But there's also another part of research. There is academia. And you will see, if you've been reading some articles or some journals about lactation related topics, you will know that there are IBCLCs that are researchers that carry out research, quantitative, qualitative research that actually informs our practice. So there's the two avenues. We need researchers, yes. IBCLC is considered still a fairly new profession, even though it's been around for what, about 30 years almost. So keeping that in mind, understand that there's so much work to be done as IBCLCs, and researcher is one of them. And you can do research in a couple ways. Skilled high level lactation care. So when we talk about the level of lactation care, I want to be clear. I want to talk about that this idea and framework was formed by Rebecca Mano in Oklahoma, and essentially is saying matching the skill level of lactation support to what's going on with both the birthing person and mom and baby. So we're thinking about, for instance, if there's just a family where this is first baby, they've never breastfed before, they don't have this experience, but the baby seems to be latching okay. There's no pain, there's nothing, and the mom is a little just hesitant about a lot of things. That's like a level one. If all things, there's no health history, nothing that identifies that there's something going on with either client, then okay, that would be level one. Level three could be an example, and this is just one example of someone that's on life support in the ICU who had planned to breastfeed or provide human milk for their baby, and they're unable to do so right now because of medical issues. How would you handle that case? What would you do? What considerations would you give? So that is the difference between a level one and a level three. And the goal for an IBCLC is to be able to deliver level two and level three aspects of care. Because when we look at the acuity model of that was born, level one is care that can be given by lactation supporters, nurses, doulas. It is that layer of lactation care where you're providing support and basic education for uncomplicated concerns. So high level skilled lactation care means you're thinking about not just the person, you're thinking about the medications that's going in their system, you're thinking about their current state of being. How do I provide care for someone who's intubated? You're thinking about those around them, teaching them an aspect. They have to be included into the care plan or plan of care. So it's just more detailed and involved. And that is the level that hopefully you will be working yourself up to during your clinical hours, as well as post-clinical after you become an IBCLC. Punctual and timely. Whew. We're still in COVID, so I have to remind myself that, you know. So one of the things that we found out during COVID was the word essential really and truly became a buzzword. And it was about essential providers, so to speak. And as someone being on the ground level, I can honestly say lactation consultants are essential because what was happening is that babies were still being born and families still needed lactation support. But there were so many places that were closing their doors to families because we just didn't know, right? It wasn't malicious, but we just didn't know. And so the ability to be able to support families, particularly during a pandemic, means promoting and protecting the ability to provide human milk. It is incredibly important. And along with that, it's important that we're timely. It's important that to understand that if someone has just birthed a child and they have chosen to offer their human milk and their bodies for breastfeeding or chest feeding, that 2 weeks appointment, timely. That's not timely. So, you know, not not making the time to have provisions for timely, skilled lactation support can really make or break that breastfeeding journey. And so being real clear that, you know, um, there's lots of lessons learned during the pandemic that we can carry forward that will impact our practice for later on in the future. Hopefully, we never get to that point where we were when it first began, but definitely some lessons learned. And so we have to understand that we are essential, we are timely. It is really prudent that we show up. It is our duty to show up so that we minimize the harms that are caused to families by all these additional barriers sometimes. That means making lactation care accessible. And that is what IBCLCs, that's who we are. And so just understanding that that's a charge that is a part of our ethics and a part of our scope of what we should be doing in standard. Trusted collaborative care partner. You will notice that collaborative care partner comes before trusted. I also said skilled high level lactation care, but wanting to know that these two topics, while they may be separate, they are also critically together in the same sense. So, for me, I use collaborative care partner when I am entering any client clinician relationship because it assumes that I am actually just collaborating. It assumes that I'm not the expert, that they are the expert. It assumes that I'm not the center, I'm not the decision making maker, they are the expert and decision maker. And so, we have to keep at the forefront of our minds that it's their fears and their barriers that takes precedence over our goals for them. So we always tout and we know the recommendations as lactation supporters and IBCLCs. We know that the recommendation says exclusive human milk feeding for the first 6 months, right? We also know that the recommendations say up to 2 years, right? um, and it's important that we still educate and we teach about those things. However, we do have to understand that we're collaborating in partnership and in agreement with families, that there may be a reason or there may be something that's preventing them from these milestones that are evidence-based, right? So it's important that we not overstep certain boundaries. It's important that we listen, that we see them, right? And that's how you become trusted. You become trusted to do no harm, to be reliable, and trusted to say, I see you as a person and we're in this together. And there is no hierarchy. I'm not higher than you. I'm simply collaborating to do what's best for you. And that's how you become trusted. when you go into clinical situations and you assume, yep, I'm an expert, I know all about this, I've been doing this for 10, 15, 20 years, however many years you've been doing it. And then, you go in with the thought that I'm going to show you and tell you how this should work. Right then and there, I can tell you, you will probably lose trust. No doubt about it. So when you go in sometimes and assume that, someone asks for latch support and you just go in and you start touching and doing without making a connection, without building relationship first, without even asking to touch or asking a person, what type of latch assistant did you really need, right? That's a way to violate trust. So essentially what I'm talking about is building yourself during your clinical, during your times as a learning practitioner of to become on your road or your journey to becoming an IBCLC. I'm really truly talking about person-centered care. If you look at the model of person-centered care from the of Institute of Medicine, I'm sorry. You look at the model of care, the person is the center of it all. And there's culture that I've talked about, there's a type of care that I've talked about, there's communication, and there's collaboration. And so if you want to know more, you can read more about that. But I feel it's important to really amplify that person-centered care has also become a buzzword. And it's so important to not let it become a buzzword for you in your practice and really honoring what this means and also honoring what it means to health outcomes. The opposite sometimes of person-centered care is, I won't get into a definition, but what I will say is when you see the opposite being practiced, that's a for sure way for folks to have distrust and to develop medical distrust or distrust of the lactation profession. So I started off with questions. I will end with questions. Um, Angela's going to begin to speak about the pathways, and there is lots to understanding the pathways to becoming an IBCLC. So she will talk about the logistics and the requirements and the guidelines and criteria, right? However, what I want you to also ask yourself, as you're thinking about the things that she's going to say, what pathway? What is my pathway? Like based on my background, right? And where do I live in this world? What does the market look like for IBCLCs? Where do IBCLCs work? You know, is the market saturated? Not, I can tell you that. But also, what are they making in your area? Is it mostly private practice IBCLCs? And also, how does the study fit into my life? How does study and clinical hours, all of these things? So think about that. Think about mentorship. If you are in mentorship with someone, you know someone, and think about all of these things that's going to help you plan for those next steps. So I will see you at the end when Angela wraps up, but buckle up because she's going to take a further, deeper dive than I did on your journey to becoming an IBCLC.
Thanks, Sekeita. Okay, great. So here we go with the nuts and bolts. And it can feel a little bit complicated, but we're going to give you a roadmap to becoming an IBCLC. Now, first, you need to choose a pathway. We're going to come back to this in just a minute. Each of the three pathways has components, the same components. The first one is education. The second one is clinical hours. And the third is exam prep. So now the first one, health sciences education. It's the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list for each of the 14 subjects on the IBLCE website. You can search for it, or you can find the link in the resource document, the handout that is actually attached to this webinar today. Now, the 8 university level courses are, and you don't need to write these down now, biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, And finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. Now, if you took any of these courses during your college career, they count, even if it was 20 years ago. LER partners with Walden University to provide the basic courses. Walden is online, and they've chosen the courses that best fit the IBCLC requirements. The 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions, and infection control and basic life support. 5 of the 6 general education courses can be taken through LER. The only one you're going to need to search for is basic life support. Now, in many countries, there is an in-person skills check for this training, so you can't do it all online. I have heard of some organizations, though, who will provide the training completely online. It's important to check with your local resources. The guide provides, and the Health Sciences Education Guide is something which is available on the IBCLC website. Now remember that this guide provides general descriptions for the typical courses in this area. Keep in mind that the IBCLC is international. The names used in their documents for the specific courses may not exactly fit the description of the course that you have taken at the accredited educational institution. That's okay. The IBCLC uses broad terms with the understanding that there is no universal description for what a course in, let's say, clinical research is going to cover. Now, why are these 14 courses required? The IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career as well as to help you pass the IBCLC exam. And it looks like I was sliding through and I got a little ahead of myself. So the second thing we need to talk about is lactation-specific education. This again is where LER has you covered. The education should be comprehensive and cover the detailed content outline. IBCLC requires at least 90 hours of lactation education, 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. Now, the third component is lactation-specific clinical experience. Again, we've got you covered. Now, this can be either in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. It also includes lactation assistance to pregnant or breastfeeding clients and lactation education to families and/or professionals. These hours can be obtained within the 5 years immediately prior to applying for the exam. Now, how many hours do you need? Well, that depends upon your pathway. So here are the 3 different pathways. As I said, they have to be accrued. The clinical hours need to be accrued in the 5 years prior to applying for the exam. Now, pathway 1 is for healthcare professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Health professionals, according to IBCLC, includes physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, and the Australian Breastfeeding Association. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 clinical supervised hours working with breastfeeding families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. Now, the IBCLC, or if there are several, everyone must be in good standing with IBCLC. Those who choose this pathway must have their program pre-approved by IBCLC prior to beginning their clinical hours. Now, a quick note, for those who have breastfed, chest fed, or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends doesn't count towards your clinical hours. Now, while 500 or 1,000 hours seems like a lot, there's a good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. If it's any consolation, the number of hours used to be a lot more. I've known IBCLCs who needed 2,500 to 8,000 clinical hours to sit the IBCLC exam before they changed the guidelines. So candidates who are applying for the exam through Pathway 1 need at least 1,000 hours. For the candidate who's also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBCLC recognized organization like LER, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. Now, 2 important points about clinical hours. First, it's important that you document the hours as you accrue them. Be very detailed in case IBCLC chooses to audit your application for the exam. They may want to see documentation such as a spreadsheet or another document where you counted your hours. And the second point is that those 1,000 hours do not need to be directly supervised. Now, Pathway 3 requires 500 clinical hours. It's best done in a practice setting where you can see many different breastfeeding, chest feeding people, and those who are providing human milk for their babies each day, such as in a hospital or a clinic setting. Now, the 500 hours the hours that you count towards the 500 are only those that are counted when you're actually working with families. So observation hours do not count. Remember that clinical experience is graduated. That is, it starts with observation and then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions and discuss situations. LER has an internship program with many sites around the US. Reach out to support@lactationtraining.com, and we can connect you with our clinical internship director, Amy Black, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing Amy wanted me to mention in this webinar is that you can't start to count your hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns spend approximately 75 hours in orientation before they can begin to accrue the 500 hours. Or you can take a look in your community to find a willing internship site or mentors. You may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to try to find some successful strategies with finding that good mentor. Now, while this pathway has an additional step or two in the beginning, some people will ask, well, is it worth it? It is. Why? Well, the IBCLC reports that students who come through Pathway 3 usually score better on the exam. I believe it's that mentorship piece that is the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. And according to IBCLC, the quick answer is yes. The longer answer is paraphrased from IBCLC documents. IBCLC will allow the use of technology if certain parameters are met. You will need to pay attention to the privacy rules and the Code of Professional Conduct and the clinical competencies for IBCLCs. At LER, there are 2 ways to gather your lactation-specific education. One is the Lactation Consultant Training Program, which is the full 95 hours front to back. The other is either core or bridge. These courses are designed to meet your education needs based on your background and previous lactation training. Now first, we have a comprehensive course which is called the Lactation Consultant Training Program. LCTP is a 90-hour course which is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and they know they want to be an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your computer, tablet, or phone. They're optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we'll update sooner as new evidence emerges. Have questions for the instructor? You can send an email to our support forum, and we have IBCLCs available to answer your questions. Want to discuss a concept with your fellow students? We are discussing innovative ways for people to connect. Stay tuned for more information. Upon completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBLCE exam. Now, if you're not sure where to start, or you already have some lactation-specific education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52 hours of online education and covers the basics, such as anatomy and physiology of lactation, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the CBS exam. The bridge course is ideal for people who have the basic lactation education components and need an additional 45 hours to qualify for the IBLCE exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding in disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. Not sure where to start? If you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC really fits. Our 90-hour course, as well as the core and bridge courses, are available in Spanish. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. At LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, Lactation Education Resources is proud to announce our Rising Tide and Juntos Triunfamos Lactation Equity Scholarship Program. They are designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize that one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide and Juntos Triunfamos awardees. Now, we alternate these scholarships each year. Our Juntos Triunfamos scholarship winner will be announced in the next few weeks. You can find out more information on our website, lactationtraining.com/Rising Tide. Our team is here to help you now and in the future. Tech support is open 7 days a week. You can get your questions answered by experts in the field. Last week, someone reached out to me and one of our instructors, they had a question for one of our instructors, and we were able to connect the person with the instructor in order to get additional support. Also, we provide you some ongoing support for the next steps in your lactation career. There was another student who had a question about creating a policy at their hospital, and we found the appropriate instructor, and that person was happy to answer the question and provide additional resources. So we are here to support you along your journey. Thank you very much for joining us today. And now, my favorite part, let's take a look at some of the questions which are here. Sekeita,
Yes,
see anything?
I do, Angela. Hot off the press, here is the first question.
Awesome.
Are the tests to get certified based on the most current evidence-based research? And how often, are tests updated?
Great question. Mind if I answer that one?
Go ahead.
So I'm just searching for the question here so that I can make sure that I answer the different components. So the exam is updated. In the past, it has been updated annually. So every year, they actually create a new exam. And so it's something which is updated regularly. And they actually do have a process at IBCLC where they get a group of experts from around the world, from multi-disciplines, to actually write the questions and to make sure that it matches with the detailed content outline. So there's quite a process which is done. I will say, so how often is it updated? It's updated every year. And actually, there are 2 exam administrations per year, and I believe that they are updated even between those 2. So in other words, the exam that you may take in March is going to be different than the exam that you would take, let's say, in September. So the question about, is it the latest evidence? So it is the latest evidence. However, there's a caveat to that. There are 2 points that I want to mention. One is that it takes evidence a minute in order to actually get into practice. Therefore, something which is published in 2023, some people will say, well, is that going to be on the 2024 exam? Probably not. It could be if it was something which is just so earth-shattering and groundbreaking, but chances are it's not going to be included on the 24 exam. Also, something to remember is that the process to actually create the exam is quite a lengthy one, because especially in the September administration, they translate the exam into many languages. And so that whole process of creating the exam and then the translation and the back translation is something which can take time. Therefore, if something was published, let's say in August of 23, the chances of it being on the 2024 exam is relatively slim. Also understand that even with the textbooks, there are some folks who live in countries where the specific textbook is not updated on a regular basis in their language. And so therefore, there could be a slight lag there as well. So those people whose mother tongue is not English, they may not have access to that latest information which is on the exam. So just want to sort of point that out to you, that some of those, there are some caveats which are there. Did I answer the question, you think, Sekeita? Did I catch it?
Yes, Angela, I do just want to add, just for the sake
Please.
of clarification, when we talk about evidence-based, it's important to understand what evidence-based truly means. Evidence-based is not just taking one article and saying, okay, this is new evidence, this is to call something evidence-based, it has to have a certain level and quality. And also there has to be multiple studies that is saying the same thing. And so I don't want to get off too technical about research, but I wanted to just add that into the conversation, because sometimes when we use the word evidence-based, which is also a buzzword, sometimes we really don't know the full meaning of what something, what it means to be evidence-based. So I just wanted to add that, Angela. But
Thank
we have
you.
some great, that you're welcome. Thank you. We have some great questions. And this one I just want to honor and amplify. It says, do you also have disability scholarships for either disabled lactation professionals and or supporting people with disabilities? And I think that's a fair and great question, and something that we will definitely consider moving forward. So I appreciate that question. Thank you so much for asking that. I do want to go to the next, unless you want to add something to that, Angela.
No,
Okay.
I would just encourage the person to please email us at support@lactationtraining.com and provide us with a bit of context. We would really appreciate that input. So thank you.
Thanks, Angela. Next question, our certified lactation counselor the same as certified lactation specialist? I'm going to say I know what a certified breastfeeding specialist is, but I'm not as familiar with these two particular certifications and being able to speak to them on that level. I'm not sure if you are, Angela. Um, Go ahead.
I am. So if you would like, in the United States, there's an organization called the United States Breastfeeding Committee. And that organization actually has a constellation, a group of folks who are the educators for lactation support providers in the United States. And they actually have come out with a handout, as well as the United States Lactation Consultant Association. And they have come out with a really informative handout which explains all the different acronyms in lactation land. And so indeed, there are folks who do have a variety of certifications, and I would suggest that you go to either uslca.org or US Breastfeeding. Is it usbreastfeeding.org for USBC, Sekeita? I think it is. I think it's usbreastfeeding.org, or it could be usbreastfeedingcommittee.org. So take a look at either one of those in order to sort of get a general roadmap as far as the different certifications are concerned. But I will say that the IBCLC is the one which can handle and manage all acuity levels that you referenced earlier in the call, right, Sekeita?
Thanks, Angela. How many years does it usually take to become a lactation consultant? So remember, I asked you to write down a few questions. So based on your pathway, the pathway that you determine is best for you, that falls up under the criteria that meets your particular needs or your situation. This is a question that it could take anywhere from 2 to 5 years once you get on the journey, possibly. But that depends on a lot. It depends on where you're getting your clinical hours, how often are you getting your clinical hours. So, for example, if you are supposed to have 1,000 hours based on pathway one, that looks a little bit different of having the 500 hours based on pathway three, which you have to actually be in a clinical setting providing skilled lactation support, right? So it really is dependent upon your journey, your particular pathway, and reasonably how you plan your clinical hours. And so I hope that makes sense. It also depends on if you already have the college courses, the 14 college courses that are necessary versus if you don't. So you can see how this can be, it can be a journey and feel like a forever journey. So it's just really depends on your individual circumstances.
Any comment about that journey that takes many years, Sekeita? I mean, I know for
So
myself, it took a minute for me to become an IBCLC.
yeah, it took about 5 years for I did the pathway three. I had a mentor. Well, actually, I had five
Mm.
mentors. If I'm being real honest about it, I feel like I was blessed in that aspect. But I was actually worried about if I did not get all of my clinical hours in that 5 hour, that I was going to have to do additional LSERPs. So for me, it took the full like it took some time because I was working full time. I had children. So again, we're talking about a mixture of um, situations, thousands and probably thousands upon thousands of different situations that we fall into as to whether what pathway are we taking and how realistic is it that we're going to get these clinical hours. And then when you do that and you figure out where you're going to do and where you're going, you can potentially set yourself a goal and kind of plot out, well, okay, I got to have these many hours, so I'm committing to doing this many. This is what's realistic for me. So it really does take proper planning. The 5 P's, proper planning prevents poor performance. So really the whole, all of it.
Brilliant. Thank you so much, Sekeita. Yes, that's so true. I get to answer the next question if you don't mind. This person does not have a healthcare background. After I finish my IBCLC, where will I be able to work? How will I get clients if I'm not working at a hospital and or a doctor's office? So here's a little thing about me. I work exclusively as an IBCLC. and I've been doing it for many, many years. And I have worked in a hospital, and I have worked in a doctor's office, and I have worked in all sorts of different settings, clinical settings. And so indeed, that's part of the homework that you need to do. Because in my area, so I'm right outside of the Washington, D.C. area, in my area, I can get a job at a hospital without having any other sort of credential or any other background. So that's the beauty of it, is that, and in many areas, they're finding that indeed you can get a job. So that's the thing, is check your community and find out, contact the hospitals that are in your area, find who the local lactation support providers are, what are the local coalitions in your area that support lactating people and those providing human milk to their babies. Contact those organizations and find out. Attend a meeting or two. A lot of them are online, some of them are in person, but attend some of those meetings and ask some of the people in your community. Just be really honest, be really transparent with them. And, also to mention that I work exclusively as an IBCLC, and I became accredited back in the day when you needed a lot more clinical hours. And so I actually am one of the people, not many people know this about me, but I'm actually one of the people who needed 2,500 clinical hours in order to sit the exam. And so I do know that it is a process, as we were talking before, it is a journey. And yes, it can happen. So.
Yeah, I want to just add to that. Remember, there was a question that I said, what does the market look like around you? That's going to take a bit of networking, but one of the easiest things that I find, and this is a little cheat sheet that I tell some of the folks that I mentor, is sign up for Indeed alerts in your area for lactation consulting jobs so you can see what what they're asking for as far as qualifications. And you'd be surprised, even within the same area, there are some systems, and when I say systems, I mean organizations that have multiple hospitals, right? That they have this requirement. But then there are other systems in that same area that do not have that requirement. When we
Right.
think about the equity work that's being done, particularly as it relates to lactation care and support, it's important to really figure that piece out wherever you practice at. And I know that that probably is a US specific thing. And I know we do have folks outside of the US in this call, but I just want to make it clear that all the different areas have different ways of being and doing and changing. And so sign up, get alerts for jobs in your area so that you can read those qualifications. And then also, I do want to say, don't give up on private practice. There's lots of things happening where folks are building their practice, but you do definitely want to do some type of market analysis. And that means really thinking about, for example, if you live in a rural area, what does that look like, right? It's going to be different. Your practice may be different if you live in an urban or suburban area. So
Mhm.
really, there's so many factors. Meet up with someone in your coalition, your local coalition, if you have one. Develop those relationships so you have a firm understanding of what's going on around you in your area.
Beautiful. Thanks, Sekeita. And there's actually a question that Wendy answered, but I want to bring it forward a little bit. This person lives in England, and they're about to start training to be a breastfeeding, peer supporter by the local NHS infant feeding team, which is phenomenal. And so they're going to be volunteering, hospital wards, drop-in sessions. Will that be enough for them to gain the 1,000 clinical hours? Indeed, reach out to, find out if NHS is a recognized breastfeeding support organization. I am uncertain if they are. I tend to think maybe not, but it's definitely good to check with IBLCE. There's a phenomenal national organization, LCGB, which is the Lactation Consultants of Great Britain. And so as we mentioned before, do reach out, network with that organization. It's a national organization. Do reach out to them and find out sort of what it looks like to gain those clinical hours. As we were mentioning, Sekeita, I know you said that it depends on the different practice setting, and indeed, in some parts of the world, you do need another, certification, another credential, or some sort of license in order to work as a lactation consultant. So find that out early in your journey.
Thanks, Angela. I want to continue on with, because this is similar but not exactly. It
Good.
says, are there any benefits to obtaining IBCLC other than reaching all acuities? Question, are IBCLCs more likely to be hired in a hospital setting? And I think we just tackled the bottom piece of that about the more likely. Depends on the area you work in. However, the benefits of obtaining an IBCLC, um, I could go on and on to the benefits. The fact is that if you're going to become an IBCLC, in essence, you really are working your way towards becoming an expert at really not just serving families, but also collaborating with other experts in other specialties. And so you get this more well rounded essence of lactation. So, yes, there are times as an IBCLC that you need to work with other professionals. You need to work with pediatricians, obstetricians, speech pathologists, sometimes chiropractors, pediatric dentist or ENT. And so there's benefits to really understanding human milk and also how to really provide care in state of emergencies because the IBCLC is again that I don't want to say terminal because I always feel like we learn more. There's never a terminal
Yes.
degree or a terminal education because we continue to learn, right? And we continue to become and we continue to kind of practice. But when you think about the benefits for me, I can say the benefits, and I'm just personally speaking because I'm passionate about this work, the benefits for me is seeing families thrive. The benefits for me is that I get to collect my own evidence based data. And I tell folks I am my own evidence because every single birthday invitation, first year birthday invitation that I get, it says to me, wow, Sekeita, you know what? We know that human milk decreases the risk of SIDS. We know, and to this date, and I'm not saying this in a way that, but I'm just saying that I don't have any families that I've helped that have lost their babies prior to 1 year. And so when I say I'm my own evidence, I think about it like that, and I think about that is the benefit that is rewarding to me, to be able to have the knowledge to be able to assist families almost wherever they are, and also have enough knowledge to know when I need to refer and that families are going to thrive because of that. So I could go on and on about the benefits because again, I love what I do, but I think when we think about where we work and how we work. Those are important reflective things to ask yourself, why am I getting into this work? Because I can also say on the flip side of that is you can spend hours at a family's house and not necessarily be compensated in a way that the world tells us that we should be compensated for, right? Equitable pay. We're in a capitalistic society. We got to make money to pay the bills, right? So there's all sorts of aspects to this work, and sometimes I say it's hard work, but it's worthy work. And so you have to think about it like that. That's just my thoughts. Angela, what do you think about this?
That's a really interesting question because I agree with everything that you say. And the issue for me, so I was a community support provider. I was a parent support person. And I know that in my training, as well as in the training that happens for a lot of organizations, is that you learn the normal course of breastfeeding. And yet it's so it's not just an acuity thing, but it has to do with the education and the experience that you receive as well. And I can say that as an IBCLC, I've learned so much more than people who are supporting the normal course of breastfeeding. And one thing to point out is that in all of my years and even leading support group meetings, it was always a challenge when, and not if, but when a baby walked in or a parent walked in and you were really worried because you saw things you didn't know enough to say, oh, I think this baby is not gaining weight appropriately and is having issue with growth and such. Doing the normal course of breastfeeding doesn't train you for that. But when you dive more deeply into it and become the IBCLC and you learn more about infant growth and development, that's when you can see, oh, wait a minute, this doesn't look right, and I think this is what's happening. And then you have the skills as an IBCLC to be able to dig in a little bit more deeply. Also, the IBCLC is the recognized credential around the world. And so in a lot of the different policy documents and everything else, yes, being an IBCLC is something which is important. Yes, giving support is vitally important. And the clinical care piece, that's the piece that is vitally important as well, to make sure that you can handle every situation that you may encounter. Because it is not if you walk into a client's home and there's something there where you're like, whoa, it is when. And so I can speak to that truth both as a peer supporter as well as an IBCLC. So thank you for the question. This was so interesting. Thank you so much for that question. It was great.
Thanks, Angela. There's also another question. I was a lactation counselor through WIC. Would I need to take another course to be certified anywhere else?
I'm not, no. I mean, it depends on
Oh,
what the work you want to do, right?
yeah. So when you say lactation counselor through WIC, would I need to take another course to be certified anywhere else? I think I feel like this is what you're asking, so I'm going to take a stab at it. You did some training, you got possibly some lactation education or continuing education recognition points, LCERPs. So I'm wondering if that has anything to do with it. When you think about the pathways, you would also have to have had your hours through WIC. You would also have to have your college courses you have to have your college courses, and you also would need to make sure that you have the hours that they're requesting, the 90 and then the 5 hours of communication. So
Mm-hmm.
I'm thinking that the answer to your question may be yes, take another course. And that's assuming that you don't have the college courses. So that I'm making some assumptions here based on, and I could be totally wrong. But one of the things is to really think about each pathway. Go to the website to look at the pathway. And then I usually say, make a checklist. Do I have this? If I'm this in pathway one, then okay, go to pathway two. Pathway two, though, is specifically related to institutions that have the courses that you can go through. And pathway three is developing mentorship. And so really understanding the pathways is probably going to help you be able to answer each question specifically as it relates to your situation.
Agreed. And just to note, the reason why we didn't go deeply into Pathway 2 is because there's only, I think, 7 or 8 programs around the world. So there's very few of those. And, here at LER, we can sort of do that wraparound piece for either Pathway 1 or Pathway 3. We can help you with, all aspects of it. And we're actually even removing more barriers in order to become an IBCLC with different partnerships and relationships that we are developing, that we are growing in other avenues. So if you come back in January, we'll have more news about that. Okay, is there anything else, Sekeita? Someone's asking about how the exam is graded, and I can tackle that, but is there something else, anything else first?
I had to tackle that. Let me take a look. I'll read.
So the exam is graded, it's actually each individual item is scored, and the weight of each item depends on what area of the detailed content outline it meets, but also it depends on how it's weighted. In other words, how difficult or how quote unquote easy that question is. And I shouldn't say easy, it's more, would the typical minimally competent IBCLC be able to answer this question? Right? That's sort of the standard that IBLCE uses. And so indeed, they actually score each individual item. And if it's given in multiple languages, they actually will score it according to each translation. And then they take a look to see if each question performed psychometrically the way that it should have. And if it has performed psychometrically the way that it should have, then it's included in the exam. However, if, for example, they have a question on the exam, and let's say that the Japanese translation, that most people miss the question and it didn't psychometrically perform the way that it should have, they'll actually take a look at the translation, and there is a possibility that that question will be removed from the scoring. And so then they take a look at how it performs, they rescore the exam, and then they send out the results. And the reason why I'm being a little more detailed with this, I doubt we have any folks on the call today who are waiting for their exam results, but indeed, waiting for your exam results is a challenge because it does take quite a bit of time. And it's really frustrating because you take the exam on a computer and you think, well, why can't I get my score right now? So it's really, frustrating. And as Wendy is pointing out in the chat, there are 175 multiple choice questions, and half of the content are pictures, and the other half, it's just straight questions. So that kind of gives you a general idea.
Thanks, Angela. I'm going to round it out with this last question because I believe Wendy has done such a phenomenal job with answering the bulk of the questions. This one says, in Sweden, shall I do approximately 1 month training? And I didn't want to skip this question because I don't know if there's more context to it or not. But 1 month training to get the amount of hours would seem highly unlikely to me. And so I don't know, Angela, if you have context on what this question may be asking.
I don't, and I saw the question as well. So if you are from Sweden and have that question, please feel free to reach out to us at support@lactationtraining.com, and we can take a look at your question and answer it as best we can. So someone else is asking, what are the benefits of having a CBS and the IBCLC? A lot of, what, were you going to say something, Sekeita? Go ahead.
I answered that question about someone said that they did a quick look on Indeed in Atlanta, Georgia. Hospitals are asking for. I can say right now, I know 3 clinicians that are not registered nurses and have no additional other licensure that work in hospitals as IBCLCs in Georgia. And so keeping in mind, that's why I said sign up for them, but also network, because you will find out that sometimes finding someone who holds both credentials, an RN and an IBCLC, which are 2 different, IBCLC is a standalone, I want to make that clear, that their hospitals, in some areas are not able to hire with both credentials, right? But they also still need lactation support. And so again, networking, but I do know I can name countless other folks in other areas as well, where you may see that in the job descriptions, but hospitals are willing to hire IBCLCs.
Yes, that is very true. Okay, good. Someone is asking about, so the recording does not include, it includes the verbal question and answers that we've said, but not the ones where other people have asked. And the reason why is because some of those comments and some of those questions were really specific to the individual. And so Wendy went ahead and provided them with resources in the chat. So indeed, we answered the ones that most people were asking in the chat, and we answered those verbally to make sure that we capture it on this recording. I see Sekeita's scanning the last just to make sure we got them all, because we really do enjoy this, and we know that there's a lot of questions out there for becoming an IBCLC. So I think we caught them all, don't you, Sekeita?
I think so, for the gist of it. If there's ever a question, again, that you need answered that you didn't think about, but you thought about it after the fact, you can always email support@lactationtraining.com, and we would be more than happy to assist you along your journey.
Absolutely. Thank you for joining us today, everybody.
Yes, thank you. Enjoy the rest of your day. Bye.
Bye.